Well, summer classes tentatively set to resume at the University of the Bahamas on June 15th. This, of course, may change due to emergency orders. Leah Roll, chair of UB's School of Nursing and Allied Health Professions, says they've, however, developed contingency plans and that due to COVID-19, there may very well be changes to the curriculum.
There are some things that we may have to revise in our curriculum in regards that we would need to consider the inclusion of what we would consider disaster management, risk mitigation, and responding to global pandemics. Because we do realize that nurses become the frontline responders of in these circumstances, and a greater preparation may lead to improve their readiness. So we have also looked at the use of integrating simulation. Again, nursing has been a one-to-one or a face-to-face for all of its courses. That, again, is something that we're going to have to change, because this is very well going to become a part of our new normal. And so therefore, online learning is going to become an increased part of our program. So we're going to create more hybrid courses where our students can do online as well as face-to-face. And so with that in mind, we're hoping that those are some of the changes that we would hope that would be to the advantage of students.
Now, the emergency orders designate recent nursing grads of UB who are in an interim state registered nurses. Tell us more about what factors you believe actually led to that.
Okay, it was not surprising that the Prime Minister actually escalated the graduate or the intern nurse to registered nurses. This is what is basic. This is a trend that we see basically happening globally in some countries. And with about approximately, I think the statistics is almost 200 healthcare providers are in quarantine, we have decreased our task force. And so therefore, it's a great effort. But what I do want to make the public to become aware of is that these individuals are not nursing students. They're intern nurses. And so to err on the side of caution, what the Prime Minister did is actually commendable, because it provides opportunity safety net. These students who are working in the clinical, these students, these intern nurses who are working in the clinical area, to provide a safety net and protection for them. So if they become ill, they do have something to fall on.